Recently, uh, Bridges was invited to be part of the delegation to visit Lagos, Lagos, of course, in Nigeria, where we witnessed a lot of issues concerning health. We're talking about medical research, we're talking about health security, because according to experts across the world, health security is both proactive and reactive efforts to minimize the dangers and impact of acute public health, like COVID-19 that we witnessed in Nigeria and, of course, all over the world. Like we always know, health has no barrier. And we brought back some reports from Lagos, which it's important to share as we try to build a bridge of a healthy herd of Nigerians who would, of course, be involved or who would be the leaders, especially as we look forward to 2023, because health is wealth. And that's where we're going on Bridges today. So we visited areas that have been so made for health security that if we ever had a pandemic again as a people, using the Lagos state intervention, we probably would be able to meet the challenges that will help mitigate, as a matter of fact, or in the urgency that is needed to quell any public health concern. Moving away from there, the contingent of national health advocates also were at the Nigerian Institute of Medical Research. It was an eye-opener. And so you need to be on Bridges today for you to enjoy the breakthroughs that Nigerians are putting together to improve healthcare delivery. And it's important that it's a collective responsibility, like we always say on Bridges. So welcome. I'm Mujima Konjola, and this is Bridges, building a sustainable society. And so, alongside with other members of the National Advocate for Health, Bridges, of course, was invited, and we brought back all the salient things that we should see and know that exist in Nigeria, especially as health security is concerned. Health security is not a peculiarity to Nigeria. Like I said earlier on, it is a global function, and every serious state and government must be involved. So let's borrow what we saw in Lagos and share with all of you. This is the report.
So historically, the Lagos State Biobank, and you'll hear a bit more about it, but at a very high level, we recognized in 2014 when the Ebola outbreak came that, there's something that you need, and you need a high-level biosafety and biosecurity facility to be able to, first of all, diagnose, and secondly, keep, store, inventory, and prepare to carry out research. So what we didn't have during Ebola was exactly that opportunity to comfortably have trained personnel in a fit-for-purpose facility such that you will not be putting your staff at risk. We got support from a NGO called GET, Global Emerging Pathogens Treatment Consortium. Many of us are involved in GET. So we went about this activity quietly, and we engaged with international partners. And one thing that you must know is that there is actually more funding in security than there is in health. And if you can combine the two, health security, you will realize that there's a lot of support out there that is willing to help you to generate a platform of health security or biosecurity.
This FGI product, this one in three in Africa, is a robust platform. It's able to run 284 whole genome sequence for any of the organism or human genetic material that you brought in, and 204 samples can be run over 48 hours. So it's robust, and the versatility is much because it's an open, though it's a closed system, but it can easily be adapted to for any form of diagnosis that we want to do. And we use it to monitor the variant that has been circulating in Lagos since the outbreak of the COVID-19 in Lagos State.
Now, how did Lagos State come about this, and how is it going to sustain it? The Honorable Commissioner gave us an insight, which also include the roles and responsibilities of the media.
We are ensuring that Lagos State's biological sovereignty, which is the sample and the biological data of every Lagosian, is accessible, controlled, protected, and used in a judicious manner to drive the knowledge economy and the bioeconomy. And so during COVID, we kicked into the sustainability plan, making it important to our partners, private sector, knowing full well that government was not able to fully manage the COVID response. We brought in the private sector, but we brought them in under these conditions and control measures, respecting and honoring the biological sovereignty of Lagosians. And that comes at a price. And through that price, we were able to generate enough income to sustain and drive the Lagos response against COVID-19, without us worrying about access to resources. Now, the media is very important, and we need to be able to manage the media, because the media can either be your friend or your foe. We have a civil society desk in my office, and the lady that's manning that desk is behind you, because we want somebody to hold us accountable to what we say we're going to do. And if we're not doing what we said we're going to do, somebody must come and tell us that you are not doing what you said you are going to do. And the information comes through that desk to my desk all the time. You're not doing this. You're not doing that. You said you were going to do this. And it even goes down to single voices saying, Commissioner, you said this in 2020, but you haven't done it yet. And that single voice is important to us, because that single voice probably reflects other voices in community.
Well, I haven't interacted with health security and feeling so good about that. The members of the advocates, National Health Advocates to be concise, now visited the Nigerian Institute of Medical Research. Bridges was also invited along. What we saw there is mind-boggling. The fact that Nigerians are doing so much, Nigerian scientists, I must say. The group not only interacted with the management, but we're also at the lab where things can be done, things that usually would go to seek in other parts of the world is now available in Nigeria. So let's watch that bridge, the bridge that we're trying to build in ensuring that healthcare delivery service in all its ramifications is available, sustainable, and can meet the needs of Nigerians.
NIMR has attracted most of the young minds in Nigeria who saw NIMR as a place to acquire practical skills which they didn't have in their universities. And we have them, except from the north, all down southeast, south, they come to NIMR for 3 to 6 months. And again, many of them have found out that going through some skill set learning in NIMR is easy for them to get abroad. But once you are able to tell them what you can do, it's like, you mean you can do this? Then there is a job waiting for them in the lab. So we keep on producing them. In fact, my scientists became worried at some point and said, if we train this one too now, it will go. I said, that's our job. Forget about where they are going. Let's just keep training them. When we have the opportunity to attract some of them, we'll keep them. Because we work with quite a number of Nigerian universities and research institutes. But you cannot throw away some CEO's personal idiosyncrasies as to whether they want to work with you or they want to. So you see a lot of that. But when you look at collaboration among researchers in those institutes, we have them. So it may not be directly as institute to institute officially, but it could be from researchers to researchers who are coming together and working on the same project. But we are working with a number of the leadership. NIPRID is one, NAFDAC, NCDC, MPACDA. Sometimes we are forced to work together by Federal Ministry of Health when the minister decides to give an assignment to all of us.
Okay, so these are gas chromatography, mass spectrometer. It is a very important equipment in this toxicology laboratory. It's very important in our drug discovery, research, and experiments. We also use it for pollutant and contaminants determination and identification. It's very important in our analysis of drug of abuse analysis, like in blood, tramadol, and also in determination of a lot of contaminants in water, food, aflatoxins, major causes of cancers, generally. So currently we are running some research, and I'm sure that very soon we'll have results to present and that, especially for the country.
By able to sequence 956 samples, which we submitted to this stage. So we basically use two sequencing platforms for the work. So this is the DMD, SEC E50, and MIN-ID, both courtesy of COVID-19 fund. So we divided the lab into three major sections. The first one basically is the preparation of the RNA from the nasopharyngeal sample or oropharyngeal sample. So after the RNA, we do quality check before we proceed to do cDNA conversion and sequencing.
Emission spectrometer. So this is a very important equipment also. It is actually the newest in the series of this type of equipment. It is important for the analysis of elements, especially heavy metals like lead, mercury, and all of them in water, even in human blood, in fish. And because we have seen that most of diseases that we have now cause death, that people just fall and die, and then liver, kidney diseases, most of them are actually due to things like this, that persons, they don't have history of anything, and then you find out that they just die. We are linking to this.
NIMR has been exceptionally good in trying to sustain things. For instance, this instrument we are using was purchased in 2008 as one among three. The others have stopped working over 10 years ago. This one is still working. It's been in use in 2008, and so is a lot of things here. We've been continually improving things, and with this COVID that came, and we even some funding from government, we've been able to purchase newer instruments. So we are now doing NGS, next generation sequencing with Minion and different things. So to that, we are moving forward. And one of the things I also picked from this, they're now calling health and industry. And you can see all the people we have, different people. Some of them have actually finished here, and they've gone ahead to start working in the health industry, not moving into the banking and some of them. Some of them have gone to begin to work in some of the new labs and different places. And many of them go from here to have their PhDs abroad. And they are able to do their work themselves because they have the hands-on experience. So NIMR is contributing seriously to the health industry, and we're maintaining the facilities for many years. So this has been a big plus for us.
So this is where we do some of the mixes that we do for the vaccine development project. So what we do in here is to clone a segment from another organism into E. coli. So we are trying to clone a fraction of the SARS-CoV-2 virus into bacteria so that the bacteria can be producing the SARS-CoV-2 protein. So rather than just grow the virus, the bacteria will be making the protein of the virus. Then we can use that to immunize the animals, and we can commence our immunological experiments. So on this small bench, we do DNA extraction. We work with plasmids on this small bench. She was just working with one of our test plasmids, and we need to find a way to take the plasmids into bacteria. So we use chemical methods, but now we are using electroporation method with this small looking device. So we just put DNA and the bacteria together, and this uses very high voltage, about 1,700 volts, to drive the DNA into the bacteria.
We have quite a number of local products that we have done, and we have, this year we've set a target of about 3 for ourselves. One is almost ready. We are hoping to develop an hepatitis B diagnostic kits that can also measure viral load. One, because the one we buy from outside, from time to time we are not able to get it to buy. And people want to do tests, we cannot do the tests. Sometimes they would have paid, they would have collected sample, the kits will not arrive, and people will be complaining, this and that. So we charge them that, one, we have developed others, so if we've developed this before, then you can also do the others. And I think that is almost ready. Then we're also looking at cholera diagnostic tests. That one like a point of care. We are looking at something like a dipstick. We just dip into the stool or urine or blood or whatever, and we'll be able to come up with. I believe the third one was more of an ELISA diagnostic kits for screening for COVID. We are looking at maybe universities or schools where they want to do screening before the students are going to go back to school or going to boarding houses. So those are the ones we set out for ourselves this year.
It's for throughput. It does 96 samples in 3 hours. The next 30 minutes, another is coming out.
If there's any pressure, you clear it.
So
in demand.
In a day, that's what you can do 3,000 samples with this.
3,000 in a day.
And viral loads, HIV. So we're now, they synchronized most of the Southwest to send samples to us. Those 2 rooms you saw coming in, they're just receiving samples. The rest are bringing samples in cooler, big cooler, everything. They're receiving them here. Between these 2, this will be about 1,005, 1,009. Between these 2, you can do about almost 1,000 in a day. That's just HIV viral load. You don't have this throughput for the hepatitis B and C. We use another smaller machine to do this one that can do 21 in a month. So, but this is mostly for HIV, and it puts a lot of pressure on us in the sense that when you are looking for this kind of big man and high throughput things, everything has to be barcoded. I don't know if it has reached your facilities. So most of these things are now being barcoded. The samples that are coming from your facilities, they are now trying to barcode them for your facilities so that as it's coming, we know. You don't need to transform them and put into these ones. So we can just load them directly and make things easier. So that's why they are trying to do that from the sites.
And it says their results directly.
Yeah, so once the result is out, you can even see your results. And that's it.
My experience here has been superb, and at some point I made mention of the fact that coming to NIMR actually gave me hope that Nigeria can still do better. You know, most of us in our schools, we could not actually relate with certain things like, you know, they just keep teaching you paperwork, but you might not even know what Sanger sequencing is until you get here and you see that Nigeria actually has quite a lot of equipment and NIMR is really doing well. They were actively involved in COVID-19. In fact, the sequencing of COVID-19, I think they did it hand in hand with a lab at Redeemers University, and it is very, very recognized.
So we are attempting to build a bridge that will improve health systems, and the advocates are all excited. Let's hear from them.
Internally, the infrastructure The infrastructure is modern. There are many equipments here that they are the only one that have such sophisticated equipment. In addition to that, we observe that capacity building for young scientists is a priority for the research center.
The last time I was here was about 5 years ago when I was in the House of Reps. Then we came as a committee. And 4 years down the line, what I'm seeing here, or rather what I have seen today, couldn't really believe it. This place has been wonderfully, transformed under the leadership of the DG and his management. Cannot really believe seeing certain machines, certain equipments, which are more or less not available in other countries, but Nigeria. And it means there are lots of potentialities. All we require, to do as advocates is to continue to talk, to the government, to continue to support, this institute. Because I believe with the right, support, with prioritization of research, this center will do wonderfully. And it can serve not only Nigeria, but Africa.
We need research to continue to practice efficient and effectively your medicine. So for me, it's an eye-opener. They are doing quite a lot. I didn't expect to see this much. And the challenge for all of us here is to continue to support them with advocacy to reach the maximum where they want to reach.
Anyhow, they can get other research institutes involved in collaboration. There must be cohesion. And we can now say we are the giants of Africa. I can see it coming, and we pray that it will materialize.
It's very viable. We have to be serious. We have to be organized. We have to be focused. We have to develop the investment case. We have to put the business case to really win a lot of partners. We cannot do it alone. So Nigerian government, the local partners, we have to partner with the international companies to come to Nigeria to invest and develop the companies here. We don't need to be going to any other African country or going, outside Africa. We can invite those companies to come to Nigeria to work with us and create the companies and the plant that will develop and manufacture the vaccine in Nigeria.
The message that the group should take away is to drum up support for the Institute. Haven't seen what we have been able to put in place, and knowing what mileage is left for us, which can only be supported by adequate funding, specific for research.
That's all time will permit on Bridges today. We do hope that we have been able to attempt to build a bridge that will help health systems in Nigeria. We'll be back same time next week. Thanks for watching.